Hi everybody, I'm Dr. Suhas Chandran. I'm Assistant Professor in Child and Adolescent Psychiatry at St. John's Medical College, Bangalore, India. This video is a prelude to the pre-congress workshop that I'll be doing at IACAPAP, Dubai on December 5th on the assessment and management of comorbidities in eating disorders in children and adolescents in the lower middle income countries. So the major focus of this particular workshop will be that very rarely do eating disorders actually occur in isolation. In eating disorders in children especially, the comorbidity is often a rule rather than an exception. And most of the time, by the time they reach the clinic, the presentation is colored by the presence of either OCD, purchase disorder, or a depressive disorder, or bipolar disorder, or a combination of one or more. And most of the clinical practice who handle these cases daily will tell you that sometimes, very often actually, treating the comorbidity proves to be more difficult than treating the eating disorder in itself. So, with this background, the workshop will focus on evidence-based knowledge in identifying, evaluating, and managing challenges of these comorbidities in eating disorders in children. And for this purpose, we'll be utilizing data and experiential perspectives from the eating disorder clinic of the tertiary care hospital where I work. The clinic has been running for the last 15 years, and we would like to share our experiences with these comorbidities. At the end of this workshop, we hope that the participants will become competent in evaluating the role of temperamental factors, especially perfectionism, meticulousness, and rigidity, and how that adds to the severity of the eating disorder. Looking at the role of developmental and cultural factors that contribute to these comorbidities. How do you assess and manage OCD, Asperger's, and major depressive disorders in eating disorders? And especially looking at how some of these comorbidities and these symptoms of these comorbidities are different in eating disorders compared to when they occur without the eating disorder. We also hope to share a lot of tips and strategies on how you could effectively liaise with both the pediatrics team and the physicians for managing these comorbidities, because ultimately it's a multidisciplinary approach that's going to lead to sustained large-scale improvements. So for this workshop, we would like to invite all child psychiatry practitioners, child psychologists, psychiatry residents, and even pediatricians or any of the professionals who are working with children and adolescents with eating-related problems to come and attend this workshop. We not only look forward to seeing you there and sharing our experience, but we also look forward, my colleague and I, Dr. Avinash Kamath, we look forward to listening to your experiences and learning from you as well. Bye. See you soon.